So every year, 800,000 people die by suicide, and 76% of all those suicide deaths occur in low and middle income countries, like Sri Lanka. The WHO, so World Health Organization, report that Sri Lanka has one of the highest suicide rates in the world. And this is actually simply not true. So based on actual suicide statistics, Sri Lanka has a much lower suicide rate. And this is partly because there's been some fantastic public health campaigns that have been done, which have resulted in a massive reduction in suicide rate. Having said that, roughly 5,000 people die by suicide every single year in Sri Lanka. So the problem is still there. It is a public health concern. But we have to recognise that Sri Lanka has made some significant inroads in reducing the number of people who die every year. So if we're looking at the people who do die every year by suicide, those are the 5,000 people, most of the suicide deaths occur in older men and young women. So suggesting that there is something quite different that results in people taking their lives, or the sort of causes of why people take their lives in men and women. So it's really important to try and understand what these differences are. And that will also suggest that perhaps different strategies need to be taken to reduce suicide deaths in these two groups. If we're looking at the number of people who attempt to the number of people who die, so these are similar behaviours, but so for people who have attempted suicide, we know that there's roughly about 20 suicide attempts to every suicide death. So in Sri Lanka, that would then equate to roughly 100,000 people attempting suicide every single year. And in comparison to suicide deaths, the people who are most at risk of suicide attempts are young people, regardless of gender. So suggesting that distress in young people is leading them to attempt suicide. Now, as I said, we don't know exactly what the causes are of suicide in either of these two groups, so that we have indications that there are a number of different things that might contribute, and it's never ever one single thing, and it's likely to be an interplay of a number of different factors. And that's part of what the research that me and several of my colleagues are doing in Sri Lanka, trying to understand why people in Sri Lanka are attempting suicide or dying by suicide.